Hello, how've your day been going so far?
It's been busy, lots of patients going in and out. But yeah.
Yeah, just busy, but overall pretty good.
Great. I recall you guys went to University of Houston. Have you guys been keeping up with their football team?
Yeah, I heard U of H isn't doing too well right now, but I know that they'll probably get better by the end of the season. And if not, at least there's basketball, right? They're doing okay.
Hmm. We don't want to take too much of your time today. Would a 10-minute meeting still work for you guys to talk about Dermavon Preno?
Yeah, I think that still works.
Yeah, that works.
Awesome, that's great. So just to introduce ourselves, my name is Jean. I'm an account manager with Johnson & Johnson Ethicon, and I've been with Johnson & Johnson for over 11 years. Here at Johnson & Johnson, it has been my mission to find suitable clients such as yourself, of which I can make their life a little easier when it comes to treating their patients, and I would like to pass it off to Kirah now.
Thanks, John. Hi, I'm Kirah. I'm account manager with Johnson Johnson Ethicon. I've been with Johnson Johnson for over 3 years, and today we hope to tell you about our product that may interest you and we believe you'll get the best value from. We would like to also know a little bit more about Jordan Orthopedic Group. And by the end of the call, we hope you may consider our product and we'd like to run a few numbers by you. How does that sound?
Yeah, I think that works.
Yeah, that sounds good.
Perfect. So before we tell you guys about our product, we have a few screening questions for you, just to know about your current situation. Is that fine?
Yeah.
Yeah, that works.
All right. So when purchasing medical technologies, what are your priorities?
When I look for medical technologies, I want it to be as efficient as possible and no hassle. So I've been having some issues with patients having to come back to my office over and over for like follow-up visits. And also another big concern of mine is sterilization because I need a product that has a low infection rate. And infections and complications have been a big reason why people have had to come back for follow-up visits, and it's been a strain on our staff.
And in your medical practice, what method do you guys use to seal up a patient after surgery?
I'll take this one, Dr. Jordan. So currently at the practice, we use staples and sutures to cover up wounds, and it's been like this for years now. And that's what everyone's experienced with it. Everyone's comfortable with using staples and sutures, but yeah.
So I actually heard that there's a spike in SSIs. How has that affected the ortho department?
Yeah, it's been kind of tough on our staff. Just trying to keep just trying to deal with all the people that have to keep coming back, and as well as the issues with price because it's been an expensive process because every time there's a complication like this, it extends the time and the price of these kinds of uh, surgeries and procedures in general. It's been a strain on our staff, I would say.
That's understandable. And do you happen to know the infection percentage of your current methods?
I believe it is 24% with a margin of error.
And of your patients, do you have an approximation of how many have allergic reactions?
I believe 10% with a margin of error.
Okay. I know y'all use the traditional staple and suture method. Does your patients require aftercare, such as like a follow-up visit with these methods?
Yeah, actually, our patients do. So, like you said, because we use staples, our patients do have to take follow-up appointments to get the staples removed. And like Dr. Jordan was stating earlier, we've had lots of SSI, so we've had to have lots of appointments to take care of that and work with that. But yeah.
Okay. I believe that Johnson & Johnson has a solution we can apply to your needs of lowering that surgical site infection, resulting in lowering costs and those needs for return visits. I think Dermabond Solutions will directly address these needs. I'll let John explain this further.
All right, so I'd like to turn your attention to the slides we have on the screen. And so here we have Dermabond Prenio, and we actually have a 99% infection-free rate. I know that infections was a big concern for you guys. We also have less than 5% allergic reactions to our product. as well as no follow-up visits required when it comes to aftercare. And we are a very versatile product. We have 22 centimeter and 42 centimeter sizes. And as you can see, our competition. And so next slide, we have all the benefits and features. We have a really strong, simple closure system. Our product also dries very fast and is simple and customizable. Our product has a very strong barrier against germs and infections, and overall, Dermabond has shortened return visits. So I'd like to pass it on.
Is there any questions y'all have that can help us make the product more appealing to you?
Yeah, I just had one question about the sizing for this. So what would I do if I had like a bigger incision or maybe a smaller incision? So of course, surgery comes in many different sizes, right? So the different incisions are going to be particular to every patient. So what would I do in the case that I had an incision that would be larger than 22 centimeters or possibly smaller? What would I do in that situation? Would I just have to use the whole thing if it was smaller, or if it's larger, can I attach two together, or what's the procedure for that for Dermabond Prineo?
Yes, so what exactly do you mean by specifically 22 centimeters?
My understanding was that the sizing of Dermabond Prineo comes in 22 centimeters.
Oh, so I understand your confusion about the 22 centimeter sizing. You're actually not alone in being confused about that. To add on, we actually also offer a 42 centimeter size, and how these two sizes work is that you can use as much of the product as you need, and any leftovers can be used for other operations. Are you still confused by this?
No, that makes sense. It's no longer a concern. Thank you so much for the clarification.
No problem.
So I do have one more concern though. So as you know, my role is to kind of budget the surgical equipment that we use at Jordan Orthopedic. And so I'm not fully convinced that the cost benefit is quite there yet in terms of switching away from what we are used to, using staples to something completely new in Perennial.
Okay, just to clarify for your question, so your concern is regarding the cost benefit to switching to Preno, correct?
Yeah, that is right.
We acknowledge that switching to a new method of closing wounds can be a little stressful, but we can assure you other practices we have worked with reported positive feedback regarding cost effectiveness of the product using Preno, save the practice money or staple removal visits, and SSI prevention and other associated costs.
Oh, okay. That's a good call. Yeah, I guess there are lots of hidden benefits to moving to Perennial, and yeah, that does clear up my concern. Thank you, Kirah.
Oh, you're welcome. Moving on, we can kind of talk about several packages you can choose from. With our option one, you can sign a 1-year contract that completely replaces all wound closing technologies for Jordan Orthopedic Group, with the 22 centimeter box costing around 224,000, and the 42 centimeter box costing around 25,000. And with each box, you can get a discount, with the 22 centimeter being $9.37 discount per box, and $14.81 discount per box with the 42 centimeter. And in option two, you can sign a 1-year contract that replaces half the budget of all your wound closing technologies, allowing a smooth transition to Dermabond Preno, with the 20 centimeter box costing around $113,000 and the 42 centimeter box costing around $13,000. What are your thoughts about that?
Well, that's actually a very convincing approach. Yeah, like I personally, Dr. Jordan, I like option one a lot, like especially considering how she explained how there are other cost benefits of moving to Perennial completely. We could save money in terms of, moving away from staples and all those SSIs and follow-up visits. We could definitely save money there, and then, um, we'd be we'd be not wasting money by doing half and half in option two. So I like option one. What about you, Dr. Jordan?
Sounds great. Yeah. Option one, it seems to be a great product, and the benefits are clearly there in terms of costs. Yeah, option one sounds good.
I'm glad you picked option one for your practice. Our team will send you a contract. You can just send that right back. Thank you. It was a pleasure to meeting y'all and y'all taking the time to hear our product and buy from us. And if you have any problems with the product, you can contact our team and we'll send a representative to help you out. And you're welcome to call if you have any questions.
All right. Thank you so much.
Thank you.
Thank you so much.
Have a good day.
You too.